And good afternoon, everyone. We have now administered almost 130,000 doses of vaccine and have fully immunized about 37,000 Albertans. I am pleased to say that 71% of residents of long-term care and designated supportive living have now received both doses of vaccine. These people are most at risk of severe outcomes, and the rest will receive vaccines in the coming weeks, according to their immunization schedule. Others who are 75 and over, who live in supportive living sites not in the designated category, will be offered immunization when enough vaccine arrives to begin the seniors' immunization rollout. Over the last 24 hours, we have identified 339 new cases of COVID-19 and completed more than 10,800 tests. Our positivity rate currently stands at about 3.2%. I continue to ask all Albertans to stay home and get tested if you experience even minor COVID-19 symptoms or if you were a close contact of someone with COVID-19. Testing is important to be able to understand how the virus is spreading in the province. There are currently active alerts or outbreaks in 303 schools, or about 13% of schools in the province. Currently, these schools have a combined total of 867 cases since January 11th. Overall, we have detected 16 new variant cases in the province, thanks to our aggressive testing of the vast majority of new cases. This includes new cases linked to a school. We were informed today that there are now 2 cases of variant COVID-19 where in-school transmission is likely the source. I am aware of 7 classes in 6 schools overall where a variant case has attended while infectious, and despite rigorous follow-up, this is the first time in one of these schools that we have identified variant transmission occurring in that location. Health officials are responding and making sure that anyone who is at risk is in quarantine and being offered testing twice. We are being extremely cautious to protect the health of everyone involved and to limit any future transmission. Just as our currently dominant strain of COVID-19 occasionally spreads in school, we will identify occasional examples of variant transmission as we are sharing today. However, knowing about variant cases means we can limit further spread, and the majority of in-school exposures so far have not led to transmission. Fortunately, we continue to see a decline in our hospitalizations. There are 421 people in hospital, including 77 in the ICU. While this is well below our peak in December, it is still about 5 to 7 times higher than our total during the spring and summer. We will continue to watch these numbers, as well as our leading indicators of positivity rate, case numbers, and growth rate over the next few weeks. Over the last 24 hours, 6 new deaths were also reported to Alberta Health. My sincere condolences go to the families, friends, neighbours, and caregivers grieving the loss of these individuals, and to anyone mourning the loss of someone they loved for any reason. I know that the restrictions needed to limit the spread of COVID-19 make it difficult to mourn in the ways we usually would. That is one of the reasons that today I'd like to talk briefly about mental health and self-care. The pandemic has made countless aspects of our lives more difficult than before. Every Albertan has been impacted in different ways. It's not surprising that the past year has taken a toll on mental health and well-being of many of us across the province, across the country, and around the world. It's now been over 11 months since COVID-19 arrived in Alberta. In many ways, we've each gotten used to parts of our new normal, wearing masks, physical distancing, washing our hands. But that doesn't mean these things don't continue to impact our mental well-being. Isolation, staying distanced from one another, financial hardships, remote learning, teleworking, keeping up with new information, and coping with sickness and death impacts all of us. Last fall, the Health Quality Council of Alberta released the results of a survey of Albertans' experiences during the pandemic. Its findings are not surprising. 70% of Albertan respondents reported feeling stressed out. 46% expressed loneliness, and more than half felt that their mental health had gotten worse. Similarly, a National Canadian Mental Health Association survey in December found 40% of Albertan respondents felt their mental health had deteriorated since the onset of the pandemic. Today, I want to remind all Albertans to take care of their mental health. The physical symptoms of COVID and the physical aspects of the pandemic are visible, but our mental health can sometimes suffer in silence. It's important to look after your own health and well-being. Try not to ignore, avoid, or suppress anxious thoughts. Instead, be aware of your anxiety and acknowledge when you're feeling anxious about a situation. Then use a strategy that works for you to address that feeling, whether it be exercise, talking to a friend or your doctor, or making sure you're getting enough sleep. If you feel like you need help, don't wait to reach out. No matter the challenge you or a friend or family member may be facing, I want you to know you are not alone. Help is available, and there are safe ways to get the support that you need. Mental health services and residential addiction treatment for those with substance use disorder continue to operate with the appropriate safety protocols in place to ensure that help is available while staying protected from COVID-19. Free, confidential, non-judgmental support is available 24/7 through a variety of service providers in the province and across Canada. For children and youth, there's the Alberta Youth Mental Health Hub online and the Kids Help Phone. For adults, there's Alberta's Mental Health Helpline, which offers around-the-clock confidential support. The Addiction Helpline also provides confidential support for alcohol, tobacco, drugs, and problem gambling. There's also Together All, a free online network that offers Albertans 16 years of age and older with anonymous peer-to-peer mental health services 24 hours a day, 7 days a week. Phone numbers and details about these services and other resources are available on ahs.ca/help-in-tough-times. During these tough times, it's especially important to stay connected with friends and family. This is absolutely the time to lean on each other. Helping others cope with stress through phone chats or video calls can help you and your loved ones feel less lonely or isolated. Each of us can also play a key role in supporting our family and friends. We can be there to listen, to offer advice, or to help connect them to professional supports. There is great power and compassion in reaching out to find out how someone is holding up during these cold, dark days of winter. Never underestimate the impact we can all have by showing others that we genuinely care, because it is more important than ever that we continue caring for each other in every way. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. We'll limit it to one question per caller so we can give everyone a chance, but if you have a follow-up, feel free to join the queue once again, and we'll get to it if possible. Operator, could you put through the first caller, please?
Thank you. Yes, the first question is from Kevin Nimick, CTV Calgary.
Hi, Dr. Hinshaw. We're still waiting for a specific Phase 2 vaccine rollout plan. When will Albertans find out when they will get the vaccine?
The Phase 2 discussions continue, so final decisions have not yet been made, and Albertans can expect to hear more in the coming weeks.
Operator, could you put through the next caller, please?
Thank you. Julia Wong, Global News.
Hi, Dr. Hinshaw. The R-value in rural Alberta has been rising the last few weeks from mid-January when it was 0.77 to now at 0.96. What factors do you believe led to this rise, and are you concerned that while R-values appear to be stabilizing or dropping in other parts of the province, it is on the rise in rural Alberta?
It is true that we have seen new case numbers start to rise again in some parts of rural Alberta. I know that sometimes people who live in areas of the province that are less densely populated may feel that COVID-19 is not a threat, but this is a really good reminder that COVID-19 spreads everywhere in our province and that none of us are protected from it unless we're taking the regular precautions that we've talked about so many times. We continue to watch the numbers and work with local public health on any specific trends and consider whether or not there's any additional interventions that are required. At this point, it seems that the challenges that are being faced, again, are similar to what we're seeing in other places, which, as we know, that while the majority of Albertans are pulling together, following the rules, that there's also a fatigue. And so this is the time to remind each other that no matter where we live in the province, we have to continue to follow the COVID-19 restrictions so that we can continue reducing our case numbers, which will enable us to start to be able to open up more of the activities that we want to see.
Operator, can you put through the next question, please?
Thank you. The next question is from Julia Deviljack, CBC.
Hi, Dr. Hinshaw. I'm wondering what other jurisdictions are you looking at with respect to fighting the variant strains? What have you learned from them, and how did that factor into the decision to carry on with easing restrictions here in Alberta?
What we've seen in other places around the world where the variant strains have become dominant, in many of those places the variant strains were introduced prior to recognition of them, and they unfortunately had already become relatively widespread before measures to prevent their spread were put in place. So what we're doing here is the aggressive testing I've mentioned before, where we are screening all of our positive cases for variant strains so that we're able to put more intensive intervention around those cases and really treat our variant cases with a containment approach to try to prevent any further spread. And we know that with easing restrictions, there is a potential for people to come into contact with each other in some of those locations that are starting to be opened if the protocols are not followed. So again, this is a reminder that the only way that the reopening will be successful is if the protocols that are in place are followed while those restrictions are eased. And those protocols will be protective against variant cases as long as people remain distanced, wear masks, and do all of those other practices that we have been advising on for many months.
Operator, can you put through the next caller, please?
Carlisle Fizette, CTV.
Hi, Dr. Hinshaw. My question has to do with the video that's been circulating today online about an incident last night at an Earl's restaurant in Edmonton that has been confirmed by the restaurant. I'm wondering what goes through your mind when you see gatherings like that so early in the reopening phase, and what your message is to restaurants and the people who are going to visit them.
I haven't seen the video, but it has been described to me, and I would say that while people may feel that opening restaurants is an opportunity to go back to interacting the way that they may have a year ago today, that is not the case. And we know that while the majority of restaurant owners are working very hard to make sure that all those rules are followed, in some cases when patrons are showing up, there may be slippage. I want to remind all owners of these establishments, as well as the staff, as well as the patrons in those locations, that it is a collective responsibility for everyone to follow the rules and the processes that are in place. Unfortunately, if those rules are not followed, there can be consequences for those individual locations, such as fines, and in the worst case scenario, those places may need to be closed. And overall, if there's many locations that don't follow the rules, we could see increased spread, and that could lead to having to have increased restrictions again. So ultimately, the message for patrons, owners, and staff at those locations is the same for all Albertans, which is that if we want to continue to see the gradual steps forward, we have to follow the rules that are in place to minimize the chance of transmission.
Operator, can you put through the next caller, please?
Yes. Jesse Weisner, Global TV.
Hi, Dr. Hinshaw. Thanks for taking my question. Vaccine shipments are expected to ramp up next week. When will first doses start again for Phase 1A? And also, you mentioned those 75 and older will be getting their vaccine soon. How will they be contacted? How will they make their appointments? And if those are web-based, what is being organized for those who may not have good internet connection or are not as technologically savvy?
The final details are still being worked out with respect to the booking mechanisms for those who are 75 and older, and there will be more information coming about that soon. I can assure Albertans that we are looking at multiple options so that people have an opportunity to book an appointment, and that those who may not have internet access, for example, won't be disadvantaged. With respect to the first appointment booking, the focus that we have right now is on finishing all second doses within that 42-day time period. And so that will be the number one priority for all shipments coming in. Once that's completed, then the first doses will start being able to be booked again. We know that there are some healthcare providers who are eligible who were not able to get their first doses in January. And so those individuals, again, Alberta Health Services is working through the details, so I don't have specific timelines. But first doses, once we have the available vaccine, we'll be able to begin booking some of those first doses again. And as I mentioned, people can look forward in the coming weeks to hearing more about phase 2 and about the details of the rollout into the community for seniors.
Operator, can you put through the next caller, please?
Jeff Levine, Edmonton Journal.
Hi, Dr. Hinshaw. Just curious, how concerned should parents be about those 2 cases of variant being linked in school transmission? And do you feel that any additional measures should be taken at this time, or is it still a wait and see?
At this point, the transmission, again, looks quite similar to what we've seen on occasion with non-variant cases of COVID-19, where we have seen occasional examples of in-school transmission. As I mentioned, it's a small number, so 2 cases at the moment. We will be doing, of course, further follow-up. At the moment, based on the number of schools where we've had an individual who's infectious attend while infectious, where we haven't identified any further spread, this does seem like not the norm for variant, but rather an outlier. But we will, of course, be working with local public health to determine if there's anything to learn from this that may impact our approach to schools. At the moment, though, as I said, it does not seem to be any significant differences. So we will be continuing to monitor. And at this time, it seems like the in-school approach is appropriate for the current situation.
Operator, can you put through the next caller, please?
Jennifer Lee, CBC.
Hi, Dr. Hinshaw. Looking at contact tracing and the number of cases that have no known source, I haven't crunched the numbers for today, but as of yesterday, it looked like about a third of Alberta's active COVID cases had no known source. And now I know it's a significant improvement from late fall, late November, when that contact tracing system broke down. But there are some concerns, some infectious disease experts who worry about that number, that 1/3 number, and worry this will increase as these restrictions ease and people are interacting more in the community, and now with this variant potentially spreading even further. So how concerned are you about the number of cases that have no known source right now, and is there anything more really that can be done from a contact tracing perspective?
One of the things to remember when looking at that percentage that is unknown source is that combines 2 different groups of people. It combines the people who have just newly been diagnosed, so all those for whom that lab result has just come back within the last 24 hours, where the final investigation may not have been completed. So we are at the moment, the case investigators are able to phone those cases and begin that investigation within 24 hours. But that doesn't necessarily mean that all of the information will be put into our data systems within that time frame. So some of those new cases, again, it's not that the investigation is complete and we still don't know, it's that the investigation is underway. So that's one group captured in that unknown source group. The second is, of course, those for whom the investigation is complete. And despite the best efforts of the investigator, we don't know where that infection came from. We know with a long incubation period of 14 days, if people have been a part of various activities over that time frame, it can sometimes be difficult to identify where an exposure happened. That's one of the reasons that we haven't spoken much about it lately, but we do continue to encourage all Albertans to download the AB Trace Together app. We know that the more people who have this app, the more able we will be able to supplement the manual contact tracing with that automated anonymous identification when somebody has been in close contact with someone who's infectious. And that will help supplement the notification of those who may have been exposed without knowing it.
Operator, can you put through the next caller, please?
Thank you. Lauren Pullen, Global News.
Hi, Dr. Hinshaw. Thanks for taking my question this afternoon. I know that this is a follow-up on the variant spread within schools. I know that you called it an outlier, but what is your level of concern now that we have in fact seen spread within schools? And pardon me if I missed this off the top. You said there were 2 cases where in-school transmission was the source. Were those cases both in the same classroom, or did we have spread in more than one classroom? And are you able to say what zone that school is in?
So first of all, the 2 cases were from the same exposure, so same class. And at this time, I'm not certain whether everyone involved in that exposure has been contacted. So at this time, we're not releasing the zone name. And it's really, as I've said before, the relevance of the location of spread, again, it's not that there's any additional danger to those who may live near that. We are releasing the zone information on variant cases now, so people can see where we're identifying those cases per zone. And that would be the relevant information when people are wanting to know where we've seen, in terms of the geographic areas where we've seen variants. So I would direct people in general back to that overall number, which is the more important number from a public health and risk standpoint. With respect to how concerned I am about the fact that there is this transmission in schools, we have seen, again, this variant, we've seen transmission within a few different settings. As we've mentioned previously, seen transmission in a daycare, now in a school. We're looking into some other potential clusters. We've seen significant in-household transmission, which isn't surprising. That's a dominant mode of transmission of the common variant as well, of the common strain as well. And so ultimately what we really need to do is make sure that all of us every day are following the COVID protocols, that we're identifying these variant cases, rapidly putting protections in place around the contacts to prevent further spread. So this particular incident of transmission in school is, again, one of many of the reasons why I'm concerned about the variant, but I don't think it changes the threshold beyond the other locations where we have identified spread.
All right, we've got time for 2 more questions. Operator, could you put through the next one, please?
Carrie Tate, Globe and Mail.
Hi, Dr. Hinshaw. Thanks for taking my question. I'm wondering if you can explain a little bit more about the in-class transmission cases. If these were kids sitting in their desks, if it was the Z class, if they had masks on at the time, how far apart they were from the source, that type of thing.
What's been reported to us from local public health is simply that there was in-school transmission at this time. So we're awaiting further details about exactly what that looked like and what some of those characteristics might be. And so I anticipate I'll have more information later on some of those details.
Operator, could you put through our final question, please?
Thank you. Daniela Germano, Canadian Press.
Hi, Dr. Hinshaw. This has to do with the resumption of regular Pfizer deliveries next week. I wanted to know what the province was doing during this lull to make sure there was that they're better prepared for the next round of activity of the vaccines, and if the province is revising plans based on best practices elsewhere.
We have been and continue to be working on multiple phases of our planning. So part of that is looking forward to the resumption of our phase 1 categories with additional first doses, and some of the details, as I mentioned earlier, about expansion into new populations, such as those who are 75 plus. We've also been working on longer term plans, knowing that there is the possibility that we could start seeing much larger volumes of vaccine within the next several months, and we want to make sure that we have a layered approach to be able to offer people multiple options to access the vaccine in convenient ways, and also that we're able to scale up and scale down as we need to be able to accommodate whatever volumes of vaccine we receive. And as well, we've been working on the sequencing of phase 2 groups and having discussions about how to put different groups in that sequencing and determining how we roll that out. And again, lots of discussions around that. So those have been the general themes of work. And of course, we have been looking at other jurisdictions to determine how they've been able to roll out successfully and learning whatever lessons we can. But ultimately, in Alberta, we have been able to deliver vaccine very efficiently, and we've been able to do that across the province. So we've been looking again at our strengths and where we can learn from others.
Thank you all for joining us. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe night.